Welcome to A Healer in Every Home, a show designed to empower you to use natural healing safely and effectively for conditions normally treated at home. Brought to you by the holistic healthcare professionals of the Lydian Center for Innovative Medicine in Cambridge, Mass. This episode focuses on the flu, recorded during the swine flu epidemic of 2009, but still just as useful because the remedies described here worked during the greatest flu epidemic of all time, described in this book by Sandra Perko, available online.
We'll be talking about how you can boost your immune system to help protect yourself against the flu. My name is Bhagavati Burke Lenahan, and I'm here with my colleague, Dr. Emily Chan. We're holistic healthcare professionals from the Lydian Center for Innovative Medicine in Cambridge, Massachusetts.
Thank you so much, Bhagavati, for having me on your show. It's such a pleasure. We have many patients who are concerned about the swine flu or have the flu, and we're very happy to share with you today some natural home remedies that you can use. There are no guarantees, and you must use precautions and good judgment. And if you do experience serious effects of the flu, do go to your doctor.
Thanks, Emily. So, what we're hearing from our clients here at the Lydian Center is that a lot of people are getting the swine flu with pretty common everyday flu symptoms like fever and chills, muscle aches and pains, feeling very tired, and then they're recovering. It seems like most people who get the swine flu, they're getting kind of like typical seasonal flu symptoms. However, it seems like a small percentage of people are getting the dangerous form of the swine flu. So I want to make a clear distinction. This show is about conditions you can safely treat at home with natural remedies. And if you get these dangerous flu symptoms, please immediately go to a doctor, or if you've been exposed to someone with some of these dangerous flu symptoms, please do not rely on home remedies alone. The things that we'll be recommending in this show will not interfere with Western medicine, and they may help because they're all designed to help boost your immune system. But you should not use them alone if you've been exposed to or are experiencing dangerous flu symptoms. So having said that, I'd like to start with my own specialty, which is homeopathy. Homeopathy is a system of natural medicine that's part of the national healthcare system in dozens of countries around the world. We know that homeopathy has a good chance of being able to protect you against the swine flu because it was so effective in the great Spanish flu pandemic of 1918. A pandemic is a worldwide epidemic. And in the Spanish flu pandemic, tens of millions of people died worldwide. Estimates range from 20 million to 50 million people, except the people who were treated with homeopathy. And back in 1918, homeopathic doctors were a regular part of our healthcare system, and they lost only 1% of their patients. Now, the Spanish flu was the very first swine flu pandemic. It was an H1N1 virus that killed these tens of millions of people. But homeopathy was effective back then, and homeopaths today use the same remedies for the flu that were used back in 1918. So we think it's reasonable to expect that homeopathy will be effective this time around as well. For people who want to learn more about this, for the science wonks and the history buffs, I'm going to recommend Dr. Sandra Perko's Homeopathic Treatment of Influenza. In this book, Dr. Perko recommends a particular homeopathic remedy called influenzinum. It's easy to remember if you think influenza is the full name of the flu. Just add inum on the end, you get influenzinum. This remedy is available in many health food stores, also available online. Just for example, you could go to Homeopathic Educational Services, homeopathic.com. You can get influenzinum and also Dr. Perko's books. This is probably a good time to mention that my guests and I have no financial interest in any of the products that we're recommending on this show. We're just here to share our information with you. If Dr. Perko's book is a little bit too big for you, you could also look at Dr. Randall Newstadter's Flu, Alternative Treatments and Protocol. You could get that also from Homeopathic Educational Services. So what about oscillococcinum, common remedy found in every health food store these days, and also found even in a lot of drugstores? It comes from France, where homeopathy is a regular part of the healthcare system, and where oscillococcinum is the #1 selling flu remedy in France. It's a little hard to pronounce the name, so you can just say oscillo. That's our nickname for it. Think of the word oscillate, kind of like that, oscillo. So here's a little hint. It says on the package that 1 tube is a dose. If you look in the package, there are these little tubes, and each one has hundreds and hundreds of tiny pellets, each one smaller than a grain of sand. You could swallow the whole tube as a dose, but you know what? You really only need a few pellets. And in this way, you can make 1 tube last for many, many doses. So for a preventive protocol for the flu, here's what Dr. Perko recommends. Take 1 dose, for example, of influenzinum or Oslo, 1 dose a week for 4 weeks, skip the 5th week, take another dose on the 6th week, and then 1 dose a month to help keep the protection in force for the rest of the flu season. The only thing is that if you're actually exposed to the flu, you're going to have to take a preventive dose on a daily basis. For example, in my practice, I have teachers, and in their class in school, at any given moment in time, there's at least 1 child who has the flu. So some people are just being exposed to flu on a regular basis. For people like that, they'll actually need to take a preventive dose on a daily basis throughout the flu season. So here's another little hint. Here's a way to make 1 dose last a long time. You can take 1 pellet of your influenzinum and you can dissolve it in a small amount of water. Let's say about half of this bottle would be a good amount. You put your pellet in there, you shake it up really well, and then all of the water in the bottle takes on the property of that particular homeopathic remedy. So then 1 sip becomes a dose, or if you want to share it, you can give a capful or give a teaspoonful as 1 dose. So in this way you can make it last throughout the whole flu season. So what happens if maybe it's too late for this, for the prevention? Maybe you feel like you're already coming down with something. I'm going to share with you a homeopathic remedy, not too well known, used a lot in Europe, where they're really experts on homeopathy. This is the remedy to use. You know when you're feeling a little under the weather, and maybe you're needing a little bit more sleep, you're kind of losing your appetite, and you think you're not actually sick yet, but you think, oh man, I'm heading in that direction. Well, there's a remedy that will just nip that in the bud. And the remedy is called ferrum phos. Think of ferrum, like iron, phos, like phosphorus. That remedy is probably going to come in a small bottle in the health food store, a bottle that looks something like this. So ferrum phos can nip things in the bud before they really get started. And by the way, it'll work great for kids too. If you're a parent, you probably can tell when your child is about to get sick. You probably can get, your kid gets that look, that kind of glassy look in her eyes, and maybe doesn't really want to eat anything, maybe a little whinier than usual, but she doesn't actually have a fever yet. She's not actually sick yet. Again, nip it in the bud with ferrum phos. And by the way, kids love taking homeopathic remedies. The remedies taste like little sugar pills, so kids really enjoy taking them. What happens if you actually come down with a full-blown case of the flu? The first thing you're going to do is take your preventive remedy, if you have one, influenzinum or Oslo. If you have one of those on hand, what you want to do is step up the frequency of doses. As a preventive, you are taking only maybe 1 a week, maybe 1 a day. But if you actually have flu symptoms, take it 2 to 4 times a day. In fact, if the flu symptoms are really strong, if you are just being leveled by that flu, you could take it as often as once an hour. Again, putting it in water is a really good idea. Makes it a little bit stronger that way. So if that still doesn't work, I'll tell you why. It's because in homeopathy, we don't go by the microbe or the virus. We try to match the exact symptoms. Both influenzinum and Oslo are what you could call broad-spectrum preventives. But once the flu is really in full force, you may need a remedy that matches your specific symptoms. In the health food store, you're probably going to find something that looks like this. We call it the blue tube. So there are a number of different remedies you could use for the flu. I'm going to suggest probably the homeopath's favorite one. It's called gelsemium. It's made from yellow jasmine. And the name kind of sounds alike, jasmine, gelsemium. So each homeopathic remedy has a specific symptom set. And here are the ones for gelsemium. This is called the drowsy, dopey, droopy, dizzy remedy. You know when you get the flu or any viral infection and you feel like you're just totally flattened, you don't want to get out of bed, you can't even open your eyes, you feel like your eyelids are kind of a half-mast, you know what? You can tell when someone in your family needs this remedy because they get that kind of droopy eyelid look and your head feels totally fuzzy-brained. If your symptoms match what I just described, then gelsemium might be the perfect remedy for you. So now we've reviewed some preventive remedies, some treatments. We have influenzinum, Oslo, ferrum phos to nip it in the bud, gelsemium as one of a number of possible remedies if you actually get the flu. If that's not your best match, look in one of the books I just recommended, Perco or Neustadter. And so now we're going to turn to Dr. Emily Chan, and she's going to share with us some natural remedies from her naturopathic storehouse. Dr. Chan?
Wonderful. So I'm a naturopathic doctor.
Maybe you could explain what's the difference between that and a nutritionist, Dr. Chan?
Sure. A naturopathic doctor is definitely different than a nutritionist. So naturopaths go through 4 years of undergraduate pre-medical work and then another 4 years of medical school. Licensed naturopaths then must pass board exams. So you might ask, what's the difference between a naturopathic doctor and a medical doctor, an MD? Naturopaths use herbs, they use nutritional supplements, diet, lifestyle counseling, etc., where MDs would use mostly drugs and surgery. Naturopaths now are currently already licensed to practice as primary care doctors in 15 states in the United States.
Okay, so what do you have for us from your naturopathic medicine chest?
I would love to share that with you. So I wanted to mention that anything that we share about swine flu would most likely also apply to the regular flu because they're both caused by viral infections.
True of homeopathy too, thanks.
Right.
Clarifying that.
So one of my favorite herbs is elderberry. Elderberry, or Sambucus nigra, has been shown to inhibit the H1N1 virus just as effectively as Tamiflu. Tamiflu is used to treat the regular flu and swine flu, but now you can use a natural herb, elderberry.
And not worry about side effects, so be totally safe. And how would people take elderberry?
Elderberry comes in an alcohol extract, a glycerite, chewables, or syrups. A glycerite is alcohol-free, and thus it tastes very delicious and children like it. I usually use 1 to 2 dropperfuls per dose.
Great. So any other herbs you can recommend?
Another herb that you may not have heard of is called Lomatium or Lomatium, and it works, in my clinical experience, much better than echinacea. The thing with echinacea is that it's gotten so popular that there have been numerous manufacturers, and unfortunately about 40% do not pass consumer lab reviews. But for the good quality echinacea that you get, it tends to work well if you're still in an incubation stage. Once you actually do get the flu, it seems to have less effect.
So what about vitamin C? You recommend that?
Oh, I do recommend that. Actually, one more thing I wanted to mention about the Lomatium before we go to vitamin C is that Lomatium tends to reduce the severity and the duration of the infections, and it seems to be a lot more potent. I do want to say that for some people, very, very small population, Lomatium does produce a rash similar to a drug reaction rash. That's usually more common in people who are allergic to celery. So if you are, don't take Lomatium, otherwise it's a great herb.
Great. So it sounds like when my clients say that echinacea didn't work for them, I think it's because they started it too late, and they should be doing it more preventively. And then if they actually get the viral infection, like a flu, they should maybe switch to Lomatium.
That's correct.
So I'm wondering, is vitamin C kind of old hat, or are you still recommending vitamin C? Or something replace that?
Wonderful. Vitamin C is actually very neat. Let me tell you a little bit about how viruses replicate and what vitamin C does. So vitamin C works with the viruses in this way. A virus is dead on its own. It cannot reproduce. Vitamin C can help prevent the virus in this way. The virus would need to infect or hijack a host cell before it can actually make more virus. What a vitamin C does is that vitamin C prevents in an infected cell the proteins of the virus from reproducing. Vitamin C also in the virus particle inhibits the enzymatic activity so that the virus is less able to penetrate the host cell.
Great. So how much should people take, and how should they take it?
I recommend 500 milligrams to 1,000 milligrams of vitamin C every 1 to 2 hours. The reason being, vitamin C is absorbed better if it's taken more frequently. For example, if you take 1,000 milligrams of vitamin C, only 50% of that gets absorbed in the body. Whereas if you're taking 20 milligrams of vitamin C, 98% of that gets absorbed. So if you spread it out throughout the day, you're able to get more than taking it all at once. That's also true for other supplements or homeopathic remedies that you're taking while you're ill. It's a great idea to just take something every hour so that you keep your immune system boosted, of course, every hour while you're awake.
So you're kind of rotating through your different supplements. How would you know if you're taking too much vitamin C? So people might be concerned that that's a lot.
So vitamin C you want to take to your bowel tolerance. If you're experiencing diarrhea, that just means that you're taking too much vitamin C because it's affecting the osmotic balance in your intestinal tract.
So if people get diarrhea, then they're not actually getting sick from the vitamin C. It's like their body can't really absorb anymore. So that's how they learn the upper limits of how much they can take.
Exactly, that's correct.
Okay,
so you don't have to worry about that. Just back down the dosage a bit.
Okay, great. And what about vitamin D? We're hearing so much about the nationwide epidemic of vitamin D deficiency. And is that going to help with the immune system?
Vitamin D has become so popular, and if you look on PubMed, there are just journals and journals and journals about it and its applications in autoimmune diseases, in mood disorders, in the immune function. And today, of course, we're talking about immune function. Most of my patients here in Boston, we're at a high enough latitude on the globe that most of them are actually deficient if you're testing their blood for vitamin D levels. So I usually recommend in that case anywhere from 2,000 to 5,000 IU of vitamin D. With the blood levels, you should get that checked out by your doctor. Optimal levels are 50 to 60 nanograms per deciliter in the blood.
Great. And we're talking about higher northern latitudes because there's not actually enough sun exposure at these latitudes for people to make vitamin D in their skin, which is what would naturally happen. So in the winter months, it's actually safe to assume what we're finding when we test blood levels is that most people are deficient in vitamin D, and that people could safely go ahead and start taking a few thousand while they're getting ready to get the test taken and so forth. Several thousand a day might be a safe amount to start off with.
Yes, that's wonderful, and it's definitely implicated in the prevention of swine flu, vitamin D.
Good. Any other vitamins?
Yes, vitamin A. Vitamin A gets depleted every time you get a respiratory infection. That makes you more prone to getting repeated respiratory infections. The upper limit for vitamin A would be 10,000 IU per day. And vitamin A is found in your fruits and vegetables that are basically red or orange pigmented.
Great. Any other tricks up your sleeve, Dr. Chan?
You might have heard of probiotics. Probiotics have been very common in yogurt, and you might have heard of strains such as Acidophilus or Bifidus, and uses for yeast infections, gastrointestinal complaints, or even hospital-acquired gastrointestinal infections. Now there has been more research on using probiotics and more specific strains for things even like ADHD, depression, Clostridium difficile infections, yeast infections. You can use all different strains that are more specific. So for the swine flu, there's a strain called Streptococcus salivarius that seems to inhibit it.
So when I hear streptococcus, I'm thinking about strep throat and the microbe that causes strep throat, which would be a dangerous organism. So this one is a safe or even beneficial one?
Yes, it might sound scary. So strep throat is caused by Streptococcus pyogenes, which kind of sounds like Streptococcus salivarius. Streptococcus salivarius is a normal flora oral strain. And there has been a lot of myths about bacteria. We often think about antibiotics and want to kill all the bacteria, thinking that they're all bad. Some bacteria do infect and cause disease, but other bacteria actually work in a symbiotic relationship with the human body to help prevent disease.
So Streptococcus salivarius is the one you want, and you might think about, it sounds like saliva, and this is the bacteria that lives in the mouth.
Yes, so
Normal
this is the
natural
one
bacteria.
that is specific against swine flu, but with any good quality probiotic that you can get, it does support the immune system.
Great. Any thoughts about safety? Any limitations on safety for the things you recommended?
Safety. What we talk about here are mostly safe. I do have some more specific supplements for immune support that I do use for my patients, but these are great ones that you can use at home to start with. I do want to mention that the fat-soluble vitamins such as vitamin D, vitamin A, and vitamin E are ones that you want to be careful with in not overdosing because they are eliminated less easily than your water-soluble vitamins. Talking about safety, why don't we go back to homeopathy? And I wanted to ask you about the safety of homeopathic medicines.
Great. Safety is actually one of homeopathy's strong suits. Homeopathy basically has no side effects. Sometimes if people take a remedy from a professional homeopath who gives the remedies in very high potencies, much stronger than you get in a health food store, the remedy might be too strong and cause some temporary and fleeting symptoms. So you might have heard of that. But in the potencies or strengths that are found in a health food store, remedies will not have side effects. They're totally safe. In fact, if a baby were to swallow a whole tube of a homeopathic remedy, nothing would happen. And that's because when homeopathic remedies are made, they're diluted so many times that not even one molecule of the original starting substance remains. Now, I know what you're thinking. How is it possible? If these remedies have nothing in them, no active ingredient, how the heck then can they work? Well, I'm going to try to give you the short version of that. Think about a flash drive that you use for your computer. You could have a little flash drive, a thumb drive this big, that stores an enormous amount of information. You could store a whole library of books on a little flash drive. Think of a homeopathic remedy pellet as a tiny storage device for an enormous amount of information that tells your body's healing energy how to deal with a particular health condition. Well, our bodies don't have USB ports. What we have is a mouth. In goes the homeopathic remedy, and with it, a tremendous amount of information that coaches or trains your body's healing energy. And that's why remedies can be effective, even if they don't have any molecules of the active ingredient in them. So now, I bet you're asking, if in fact they are so effective, why is it that we never hear about them on the news, and why aren't our doctors recommending them? Well, here's the answer. Remember I mentioned gelsemium, or made from yellow jasmine? Most homeopathic remedies are made from common plants or common minerals. They're not patentable. They're in the public domain. They are the people's medicine. They're your medicine. Since they can't be patented, the homeopathic manufacturers don't make that much money on them, certainly not enough to pay for ads in medical journals, sales reps to visit doctors in their offices. Busy doctors, what can they do? That's the way they get their medical information. Homeopathic manufacturers can't pay for lobbyists on Capitol Hill. You probably know there's more lobbyists on Capitol Hill for the drug industry than there are congresspeople. And also we can't afford direct-to-consumer ads on TV. Instead, we rely on word of mouth. We count on people like you who try them and find that they work to tell their friends. So back to you, Dr. Chan. Do you have any parting thoughts for our audience?
So we've been mentioning about natural remedies, herbs, homeopathic remedies. And with naturopathic medicine, we want to go back to the basics, the principles of the naturopathic medicine and the therapeutic order of cure. It's kind of like a ladder, and you look at different rungs, and you want to start from the bottom of the ladder to go up to the top. The basics might be stress reduction, sleep, hydration, eating the right foods. And if you look at a house, the foundation is so much more powerful than that picture hanging on the wall. So we must not underestimate the importance of the foundational basics. Rest is very important because when we're feeling ill, that's sometimes a signal for your body to stop and rejuvenate itself. I also wanted to mention hydration because that is a way to flush out all the toxins in your body. Stress, new areas of psychoneuroimmunology, studies of how that relates directly to your immune system. And then lastly, acid-alkaline balance. You might remember that in chemistry. And we want to be sure that our body is in a more alkaline environment because that is an environment that makes your body much less susceptible to infection by viruses or bacteria.
And how do we alkalinize? What do we do?
We can have fruits and vegetables. In general, those are much more alkaline. Sugar, white flour, meat are more acidic. Of course, we need all food groups, but the American diet sometimes is skewed so much away from our fruits and vegetables, so we want to include those.
So I'm wondering, you're recommending fruits and vegetables to alkalinize, but what about an acidic fruit like a lemon? What kind of an effect would that have?
That is a great question. You may taste a lot of fruits and they're quite sour. So a lemon actually reacts in the body to stimulate the pancreas to produce enzymes that then cause the alkaline reaction in the body. It's a great alkalinizer, cleanser, as well as a great source of vitamin C.
Great. So, can I share my parting thought?
Please share your parting thoughts with us.
First, I want to mention a couple more sources of information. I've given you a lot of information about homeopathy today, and I mentioned Homeopathic Educational Services, homeopathic.com. I'd also like to recommend the National Center for Homeopathy, homeopathic.org. It has right on its homepage the flu forum with lots and lots of information, articles and so forth about the flu. And again, I have no financial interest in any of these products. Just want to share the information with them. And speaking of that, I feel that we have not just one epidemic in this country, the swine flu epidemic. We actually have two epidemics. We have an epidemic of fear. We hear every day about people dying from the swine flu and about how there are not enough vaccinations. We hear about apparently healthy young children or young adults going to the hospital, and the best of Western medicine is not able to save them. The result is that people are feeling afraid and feeling powerless. When people feel fear and helplessness, that in itself tends to weaken their immune system and make them less able to fight off the flu. So I'm wondering, do you think there's a way that we could transform this situation, that we could turn it around? Instead of having an epidemic of fear in this country, do you think we could turn that around and have an epidemic of empowerment? An epidemic of people like you and me trying these natural remedies. They're safe, they're inexpensive, easily available, they may work. Why not try? See if they work for you. They follow the first principle of Western medicine, which is first do no harm. So maybe you could try them, or ask your friends and family members if they've tried any natural remedies and what seems to work for them. If you find something that works for you, maybe you could share it with the people around you. I like to suggest that if you do, it'll come across much better if you're not pushy or if you don't pressure them, but instead, if you like to share what you've learned, maybe you could do it humbly and from the heart and say, this is what worked for me. I'd like to tell you about it. Would you like to hear more about it? And if they do, if you can pass it along, maybe you can help to create a national epidemic of empowerment. This is Bhagavati Burke-Lenihan with A Healer in Every Home. Thank you so much for joining us. Thank you so much to Dr. Emily Chan from the Lydian Center for Innovative Medicine in Cambridge, Massachusetts. Thank you.